In a society dominated by fashion and image, the goal of many women is to realize their desire to have shapely and well-proportioned breasts. This is because the female breast has been, since antiquity, the principal characteristic of femininity. With a simple operation, you can have a more attractive figure.
Hi, I'm Dr. Kenneth Levine. Welcome to Health Talk. Health Talk is a show about your total wellness from the top of your head down to the bottom of your feet. I happen to be a dentist. I'm a periodontist. I treat gum and bone disease. We do dental implants and cosmetic surgery. My patients range in age from 3 days old to about 100 years young. And we've been doing this in our office in Tamarack, Fort Lauderdale for the past 37 years. But tonight is not about me. It's about plastic surgery. I'm here with Dr. Jason Altman. Jason, welcome.
Thank you.
It's good
Thanks
to
for
see
having
you.
me. My pleasure.
We're here talking together, but there are viewers here who don't know anything about what you do. Tell us a little bit, first of all, about your background, how you got to where you are today.
Sure. My background involves about 8 years of training, starting with medical school, obviously, and after that I did a residency in otolaryngology. People know it as ear, nose, and throat surgery or head and neck surgery. From there I went on to do additional training in plastic surgery.
Well, let's stop just for a second. You were in school a long time. You grew up in Long Island, I know
I
that.
did.
And then you went to college, where?
Dartmouth College up in New Hampshire.
Then
Medical school was the State University of New York, Stony Brook.
Okay, so we're up to like a lot of years, and now you went and said your ENT was for how long?
5 more years.
5 more years, and then all of a sudden you decide that wasn't quite enough. You went to plastics, and how many more years was that?
That was another 2 years here at the University of Miami after 5 years in New York City. That was the plan all along. I just knew that I wanted a big portion of my practice to be involved in surgery of the face, and I felt that the ear, nose, and throat and head and neck training would prepare me for that very well.
Okay, so you can go from the inside all the way to the outside.
Exactly.
Okay, so you can fix the bones and fix everything on top of the bones. All right, so you ended up, after all your volumes and volumes of education, where did you go to?
Well, I'm not done. I did 1 more year.
Okay.
That was called a fellowship. It wasn't exactly training, but I spent a year traveling the world with an organization called Interplast. They do free surgery for children and adults in developing nations where they may not have the resources to provide the care that they need.
Is that like Smile Train and things like that?
Similar concept. Interplast was actually, they're now renamed, they're called Resurge International.
Okay.
And they were the first US-based organization to do overseas cleft lip and palate work.
Okay.
They work in South America, Asia, Africa, and really anywhere there's a need. So I spent a year traveling with the various surgeons that work with them, both performing surgeries in these countries and training local surgeons how to do the operations and how to take care of the patients afterwards.
It's a fabulous thing. I know we donate to Smile Train, I'm familiar with, and for $250 you can change somebody's life.
It's amazing, yeah. 45-minute operation, and this child all of a sudden can go to school, can get a job, can get married, can become a functional member of society. Most of these countries, it's not the same as the United States, where a physical or disability really doesn't limit you as much as it does in those countries. There's still a significant amount of prejudice against them.
Just as an aside, is there a reason that it's seen more in the underdeveloped countries?
What we understand about most of these problems, the lips and palates, is that there's a genetic component to them. And in a lot of these developing nations, number one, they don't have the same level of perinatal care that we get here in the States. And a bigger part of that is they don't have the genetic diversity, in the sense that most of these are small communities.
Right.
They tend to stay within these small communities, and so you don't have people migrating out and diversifying the gene pool.
So you could have relatives marrying relatives. And
exactly, and even if they're not direct relatives, they all sort of came from the same original.
Okay, so that's your extra year.
Yep.
And then you decided that it's time to go ahead and go to work.
That was, yeah, at that point it was time to make a living with all those years that I had spent training. And opened an office in Coral Gables called the Plastic Surgery Institute of Miami. And there we focus 100% on aesthetic and cosmetic plastic surgery of both the face and the body.
Okay. So, and is that where you're practicing now?
Yes.
Okay. And from what I understand, you're opening a new office?
Yep, we're in the process of rebuilding or opening a new office. Same neighborhood, right across the street, right off the Miracle Mile in Coral Gables. Right. And we're building a 5,000 square foot brand new facility with our own operating suites. So we'll be able to take care of our patients 100% in-house. from their initial consultation to their blood work to their surgery to their recovery. I also occasionally will do traumatic reconstruction, facial fractures, things like that, and those are often done in the hospital because of the equipment needs for those surgeries.
Gotcha. Okay, you know, we're going to be taking breaks as we go through this, and we're going to come back in just a moment. I'm Dr. Kenny Levine with Health Talk, and we'll see you in a minute. Thank you.